of the moon, we could sit and do nothing.
Hi, YouTube fam. I am Angeline, the nursing assistant. Today we'll be discussing the job description of a nursing assistant. Number one, you have to bathe the patient. Some patient that is bedridden, you will have to do a HaryaLift, and that's the type of machine that will actually lift a patient that cannot walk, and they have like a bed, a gurney bed, and it's really a shower bed. You would put that patient on and you would take her to the shower room and bathe that patient. So we have to bathe all types of patient, the ones that can walk, the ones that bedridden. Usually the one that's bedridden, you would give a bed bath, but at least once a week, if they're in a nursing home, at least once a week, they like for that particular patient to get up and go to the shower. And when that happens, that's when we'll use the HaryaLift, and that's the machine that we use to get up a patient that cannot walk. And we'll put them on a gurney bed, which is a shower bed. Number two, you will have to groom the patient, and that entails keeping the hair clean, combing the hair, brushing their teeth. For men, you will shave, and some women's you have to also keep them shaved. Number four, I think we're on four. You have to turn the patient, the ones that stay in bed that can't move themselves. You have to reposition, turn them every 2 hours, and this is to prevent them from getting decubital ulcers, better known as bed sores. And also you have to feed a patient. Some patient cannot feed themselves, so you will have to feed them, and also you will have to chart on their intake, their food intake, and their liquid intake. Number five, you also will have to keep up with their output. And when I say output, I mean like some patient may have a draining tube, and that's a tube. Usually they have that, usually when they come out of surgery, they have a drainage tube where all the fluid and liquid, some be like a little bulb. You may have seen that before, but anyway, we will have to keep up with that and record how much drainage is coming out, and we have to chart that. And also we have to keep up with with their urine output and also their bowel. Okay, number six, we have to sometime assist the nurse in different medical procedures that it takes two people to do. We would do that. For instance, sometimes we may do help them with their wound care. If they got a dressing change or something that need more than one person to handle that particular patient, we would go in and help with that. Also, we have to keep up with supplies. When I say keep up with supplies, just kind of do an inventory of supplies, and when they get low, we'll report it. We'll call down and say, hey, we low in this here, we need some more or whatever. So you have to keep up with the inventory. You will have to do vital signs, and this include blood pressure, temperature, and heart rate. And sometimes you will have to check the O2 sat, and that's just checking the amount of oxygen in the bloodstream. Also, you'll be answering call lights. That's a given. You will also, when you go in, you need to be observant. You have to be very observant when you go in to do care with a patient, when you talk to a patient, because a lot of times we as nursing assistant are the first eyes on patient. We see the patient the most. We can kind of tell when something different about the patient because we are around the patient a whole lot. For example, I went into a patient room and I was talking to her and she was talking, but she had a slight slur in her talk. Just a slight, but I detected it. And her mouth was turned just a little bit. And I continued to talk to her to see was anything was going to change. I asked her to squeeze my hands to see what kind of, strength she had. And she squeezed my hand pretty good. But when I left out, I informed my nurse that she was told her the signs and symptoms that the lady was having. And I told her, I don't know, but it seemed like to me she was having a stroke. Something was going on with her. The nurse went in and checked her, and yes, she was having a stroke. She was actively having a stroke. So the nurse was able to immediately start an IV, call her doctor, start the IV, and kind of stop the process, So being observant as a nursing assistant is very, very important because we usually spend more time with the patient. We can tell when something is different, whether it's in their behavior. Sometimes their behavior change, and that indicate that something is wrong. So as a nursing assistant, you will have to be observant and aware of different changes in patients. You will be cleaning rooms and making sure her bed linen is changed and clean and tidying up the room. You will be doing transporting. If a patient needs to go to x-ray, you will be taking that patient to x-ray, surgery, or whatever other department that patient needs to go to. You will be the one that's transporting the patient. You will be transferring and lifting patients. That is all a part of our job description. So you need to use good body mechanics for that. And sometimes some facility will offer a back brace that will help, support your back so you will have less back injuries. And also you will be giving report to the oncoming shift. So I think I hit all the basic of your job description, but your job description will also vary depending on the state where you work, depending on the facilities where you work. Because I have worked in a facility, a hospital to be exact, where I had to do in and out cath. I had to do blood glucose. I had to draw blood. And I also had to do EKG. Now, all facilities, you may not have to do that. So, like I said, it depends on the area you work in, the department you work in, and the state that you work in. But I have gave you the basic job description of a nursing assistant that is pretty much across the board. So I hope this here video gave you some kind of insight what you'll be doing as a nursing assistant. Anyway, I'll see y'all next time. I want y'all to subscribe, hit that like, and ring that notification bell because you don't want to miss not one of my videos. Not one. Come on, let's get it started.